welcome to the show. I'm Maitreyi Sitaraman. We've all been guilty at some point of ignoring health and safety signs here on the road or in our office kitchens, but it does play a factor in our economic growth. So on the show, we'll head to Spain to understand the economics of health and safety with the European Agency for Safety and Health at Work, better known as OSHA, and look at an industry that seems to see the biggest issues. Then we'll head to Belgium to understand how companies and employees are innovating to ensure that we're not just physically fit, but also mentally prepared to work in challenging times. The goal, of course, is to prevent us from quitting or taking sick leaves because of issues at work. But health and safety does address issues of adapting work to our skills and abilities and taking care of our physical needs, but it also includes taking care of our overall well-being at work. So how does that tie in to the economy and growth? Let's find out.
Philip the butcher employs 25 other butchers, and because he efficiently adds value with specialty cuts and deli lines, his business productivity is high. The more he sells, the higher taxes he pays, contributing to higher overall national economic growth. But Philip's not implemented health and safety rules, as he thinks they are expensive. Accidents and illness start rising, with an average of 2 or 3 of his employees out on sick leave. Philip's productivity drops, and he still has to pay his workers salary compensation and cover medical costs. Wear and tear on plant remains the same, and he has to train replacement workers, which also costs time and money. With less to buy, clients leave and morale among employees falls, causing a further drop in productivity. Sick and injured workers see a fall in earnings and their standard of living. This puts the burden on their family and friends who take care of them. Costs to the overall economy mount as workers need social financial support along with medical treatment. Workers who leave the workforce completely need further financial and social support. Society and the economy then sees further losses as productivity falls at businesses like Philip's, which also leads to lower growth.
In Europe, we lose an estimated 83 million days a year because of accidents at work. Now, 3/4 of us will take a day off, but almost a quarter take more than a month. Then there is the 367 million days lost in sick leaves because of work-related diseases. That's a lot of productivity lost. So, funded by the European Social Fund, the new strategic framework for health and safety at work for 2014 to 2020 aims to try and address Europe's challenges: an aging population, better implementation of current rules, and the prevention of work-related diseases. Monica Pinner trekked off to Bilbao in Spain, where the European Agency for Safety and Health at Work is based, to find out how and what can now be done.
Occupational accidents in Europe represent a heavy economic burden that's still difficult to quantify. The estimated cost in 2000 was 55 billion euros, and it's still high today. Preventing this should therefore make economic sense, especially in sectors like construction, where accidents are still hitting hard. This industry accounted for 26.1% of all fatal work accidents in 2012. In Spain, the figures are still worrying.
Unfortunately, in 2013, 2014 and 2015, things got a lot worse. We're talking about an index that went down to 5,000 accidents per 100,000 workers between 2008 and 2012. The latest data reports more than 6,500 per 100,000 workers.
About 2.5 million people in Europe suffered from a non-fatal workplace accident in 2012. There were over 3,500 fatalities.
This means that there have been on average 2.44 deaths per 100,000 people employed. Variations from country to country can be considerable. They ranged from over 5 in Poland to less than 1 in countries like Germany, Denmark and the Netherlands.
Many studies have proven that workplace accidents and occupational illness can impact not only the economic performance of businesses, but also a country's economy. We met the director of the European Health and Safety Agency in Bilbao.
The countries in Europe, many of them have their own methodology to calculate the costs. Germany, for example, their calculation is that poor occupational safety and health leads to a loss of 90 billion euros, and that means more or less 3.2% of the GDP.
The global GDP loss due to occupational accidents and disease has been estimated at around 4%. In Europe, this would range from between 2.6 and 3.8% annually.
Case studies demonstrate that health and safety should no longer be seen as purely a cost. Investing €1 in well-being at work can produce at least 2.2 euros in return. In Bilbao, this workplace is supervised by the public company Visesa. The regional head of health and safety explains the potential benefits of investing in prevention for a business like this.
Health and safety costs for this work site are around €288,900 over 2 years. The security measures to be applied imply a reduction of the possibility of fines and production delays. For example, stopping production in this work site could cost €3,500 per day.
European legislation provides a binding framework, but its implementation differs from country to country by sector and size of enterprise. The difficulties we found in Spain mirror the ones found in many other member states.
SMEs that represent the majority of businesses in Spain don't have health and safety departments. They have no specific employees for that. Therefore, there is no H&S culture, with companies often not knowing the requirements or how to apply them.
In addition to accidents, in Europe, exposure to hazardous substances at work is believed to contribute significantly to mortality through carcinogenic diseases. It's estimated to result in a global disease burden of 152,000 deaths, measured in 2000. Potential negative effects include costly early retirements, loss of skilled staff, high medical costs and insurance premiums.
Their calculation on occupational cancer shows that it is almost 1% of the GDP in the United Kingdom.
No less than 8.6% of the workers in the EU reported a work-related health problem in the past 12 months. This corresponds to approximately 23 million people. Musculoskeletal problems head the list, followed by stress, depression, or anxiety.
You'd never know, looking at all these relaxed people out and about, that mental health issues cause 1/5 of us here in Europe to either quit or change jobs. It also costs companies twice as much than simple sick leaves and 5 times the number of accidents. It also costs 240 billion euros a year, 43% of that coming directly from, say, medical treatment costs and 57% from productivity loss. So Monica Pinner jetted off to Belgium to see what we're doing as employees and companies to address our overall well-being.
Work-related stress and psychosocial risks are responsible for almost half the number of working days lost each year. Absenteeism due to stress, depression and burnout is growing across Europe. This is now the number 2 reason workers are absent for more than 3 days in a row. Our offices are revealing themselves to be trickier places to work than people might imagine.
There are multiple stress situations in a multi-job role. Stress from phone calls, clients and colleagues that need help, and at the same time working through lists of things to do, lists that seem to get ever longer, and seeing those few moments in the day when you could take a breather slip away as work piles up.
The main issue for addressing psychosocial risks seems to be the taboo that still exists in about 30% of European establishments to talk openly about these issues. This reluctance grows stronger the bigger the company.
This seems not to be the case at Siemens Belgium, where the group has bet not only on health and safety, but also on employee well-being. The company has won an EU OSHA award for its good practice in stress and psychosocial risks management.
The Fit at Work program is a health promotion program to promote a healthy lifestyle, a more vital lifestyle with our people. We have the healthy nutrition, we have the physical exercise, and then also you have the mental aspect, so the psychosocial aspect.
Francois, like about half of the 1,500 employees of the company in Belgium, takes the time to do his training every week at work. Not only abs, but also coaching sessions, including stress management. All this is part of a plan with the company investing approximately €500,000 over 3 years in 2013.
Why would we start it and after a couple of years what will get back? It is a really difficult thing to say.
And so why should a company invest?
There's clear proof that caring about the well-being of people helps in so many fields that it really is a plus for the company. You believe in it or you don't.
Improving working conditions in Europe is still an issue. More than half of all workers work at least one Saturday per month, 52%, while 45% say they've worked in their free time in order to meet work demands in the last 12 months, with 3% doing this on a daily basis. Back at the European Agency for Safety and Health in Bilbao, we asked Krista Sedlacek if she could give us a bigger picture of the problem in Europe.
80% of managers are aware of the risk and they have enough information, but only 30% of companies take measures. 4 out of 10 workers say it's not handled properly at company level.
Brussels aims at improving enforcement of the European legal framework. So far, just slightly over half of the establishments surveyed in Europe report having enough information on how to include psychosocial risks in risk assessment. Without this data, we will struggle to build a healthy work environment.
So, health and safety, not as inconsequential to our economy as many would brush it off as. Next time, we're going to look at the economics of integration of vulnerable people in the urban jungles of Europe. See you then.